Today we see about the pregnancy. It is a period of pregnancy. It is a period of fertilization to birth. Fertilization to birth. It starts when a male's sperm fertilizes a female's egg ovum in the woman's fallopian tube, making a zygote with the 46 chromosomes. The zygote starts to divide, and after 5 to 7 days of dividing and growing, it attaches itself to the wall of the uterus. The moment it is implanted in the wall of the uterus, it becomes an embryo. And the placenta starts to develop. After 8 weeks, the developing embryo called a fetus. The placenta gives the embryo or fetus the oxygen and nutrition and removes the waste through the umbilical cord. The normal pregnancy lasts about greater than 280 days, or greater than 9 months, or greater than 40 weeks, or greater than 3 trimester. Normal delivery could be from 38 to 42 weeks. Signs of pregnancy. Signs of pregnancy. First one, presumptive signs. That means physiological changes noticed by the woman herself. Absence of menstruation. It's called amenorrhea. Nausea and vomiting. It is a morning sickness common from week 2 to 12. Next, breast tenderness and swollen. Urination frequency, fatigue and sleepiness. Next, physiological maternal changes. Pregnancy causes physiological changes in all maternal organ systems. Most return to normal after delivery. Increased blood supply to breast and uterus. Increased levels of estrogen and progesterone. Changes in senses of taste and smell, and increase in saliva. Softening of joints and increased mobility of the sacroiliac and symphysis pubis. Increase in blood flow, increased need for glucose, water, iron, folic acid due to developing fetus. Heart rate increases from the normal 70 to as high as 90 beats per minute. Decrease in blood pressure in first and second trimester and became normal at the third trimester. Increased breathing rate, increase in kidney and bladder size, high pigmentation of the skin. Some physiological changes are changes in senses of taste and smell, increase in saliva, enlarge of breast, increased breathing rate, increased in kidney and bladder size, increased need for glucose and water, increased blood supply to uterus, increased levels of estrogen and progesterone. Softening of joints. Next one, stages of pregnancy. Week are grouped into 3 trimester. First trimester is called week 1 to week 12. During the first trimester, hormonal changes affect almost every organ system in body. Baby developed rapidly. The major organs develop in this trimester. The menstruation stopped. Pregnant symptoms and signs. For example, mood swings, headache, and morning sickness. First trimester in the baby. The baby's brain, heart, and spinal cord have begun to form. Baby's heart starts to beat in the 8th week. The sex organs begin to form. The face starts to form. At the end of the 8 weeks, the baby is fetus and looks more like a human and about 2.5 centimeter. At 12 weeks, we can see if he is a boy or girl. and the baby can make a first cyst. Next one, second trimester. Second trimester is called a week 13 to week 28 weeks. Most of the early pregnancy symptoms will gradually disappear. Other symptoms appear such as backache, leg swollen, and heartburn. Stretch marks on the abdomen and breast. The uterus will grow rapidly in size. Fetus move at about 18 to 22 weeks. Increase of heart rate and blood flow to accommodate the needs of the fetus. Next one, second trimester in the baby. Muscle tissues and bone continue to form in the baby. Skin begins to form in the 16th week. The baby can hear and swallow at the 20th week. Real hair begins to grow on your baby's head at 24th week. The lungs are formed but do not work. At the end of the trimester, the baby now about 30 centimeter. Next one, third trimester. Third trimester is called week 29 to week 40. During this final trimester, your fetus grow larger and the body organs mature. The fetus moves frequently, especially between the 27th and 32 weeks. A fetus usually set into head down position in the uterus. Shortness of mother breath. Belly button of the mother may stick out. The breast begin to produce colostrum. Colostrum, it's nothing but it's called yellowish rich milk. The third trimester in the baby, the baby's bones are fully formed at 34th week. The eyes can open and close and sense changes in light. By the end of 37 weeks, the baby is considered full term and the organs are ready to function on their own. Near the due date, the baby may turn into a head down position for birth.